Welcome everyone to another episode of ELPA podcast. We call it Small Steps, Big Changes series, building a healthier liver through everyday habits with ELPA, where we are addressing the importance of daily healthy habits, healthy lifestyle, to empower our community with knowledge, motivation, and to essentially support each other along the way. And today I am happy to welcome in our podcast Mr. Willy Thiel. From Rotterdam.
Good morning.
Hi Willy,
Monica.
How are you?
Nice to be here.
First time in Brussels?
Second time actually for work, and of course as a tourist, it's not so far from Rotterdam, so I know the city quite well.
Really, before we dive into physical activity and all of that field, because you are working on a lot of things, so I am giving floor to you. Tell us what are you doing, how your typical day look like?
Well, I'm working the last 10 years for internal medicine for obesity care, and we're focusing on metabolic health. And my focus is also on liver disease like MASLD. And I'm also doing some research with the Erasmus Medical Center in Rotterdam about the effect of obesity and the link with MASLD and how we can manage it and try to cure it. So that's a short version of my work.
So you have busy days.
I got busy days, yes.
Okay. Very happy to have you here. So let's maybe start with the percentage of MASLD and MASH, so the prevalence in Europe. It's almost 30%, 25%.
More than 30% now, yeah.
More than 30?
It's still rising.
Still rising,
That's not the good news.
which is alarming sign, right?
Yeah.
What are your thoughts on that?
Yeah, that's a big problem, and what we see, it's going together with other diseases like obesity, what I told you, and also diabetes. So that's a problem. It's still growing, and the projection for the near future is not quite good, because we see that for now in Europe you have like almost 60% of people, adult people, are living with overweight or obesity. So we can expect that it's getting worse. So it's important to tackle it from the beginning and on, to be able to develop some campaign like this podcast, for example, to make people aware about this problem and try to work together.
So do you think we are doing enough to tackle this problem? Probably no, but...
Yeah, you answer. You always can do more, obviously, because we have all the layer. We need all the layer. We need the patient to understand what's the problem. We need the healthcare professional to treat it and to be aware about the problem. We need the policymaker who help us to make a better society for people, to help people to getting healthier. So there are still a lot of work to do. That's a good begin, but just keep it up and go in the same direction. Try to make it better. Yeah.
To keep the momentum.
Yes, exactly.
We have the scientific guidelines for MASLD and MASH, which are focused on the lifestyle interventions.
Yes.
Is it something that it's easy for patients to do, the lifestyle intervention, or?
The lifestyle intervention is quite easy because everybody can do it. But the problem is you have to know what you have to do and how you have to do it. And when you're talking about lifestyle intervention, there are several parts of it. Today we're talking about physical activity, but we can talk also about diet, because both have to work together. And they have a specific role in getting healthier. So it's feasible, but you need some kind of guidance on it from the patient perspective and also healthcare professional.
So how much of a big role physical activity plays in this term of healthy lifestyle?
Yeah. Now,
is it the most important, or maybe it's on the second place, or
it's difficult
identify it?
Yeah, it's difficult to give a ranking about it, because each part of the lifestyle intervention has a specific goal. And when we were looking at a physical activity, for example, it's good for several points. When we're talking about the liver, with physical activity, we do know that physical activity helps the liver for reducing fat in your liver. So that's the first part you want to achieve when you have a patient with MASLD. But all the metabolic characteristics are also important, like the insulin sensitivity. Making some efforts help your body to be more sensitive for insulin, so you can control your sugar level quite better. And also you're working with your muscle, and if your muscle working better, and they are more sensitive for insulin. So you also maintain your muscle mass, and then you have a benefit on all the levels. And something we sometimes forget is the psychological effect, because producing some kind of activity, it's also benefit for your psychology in a way that you're happier, you're experiencing more well-being, and then it's also important to feel well in your head and in your body. And when you put it aside from the diet needs to go together with physical activity, and this is what the guidelines are saying, to have the synergy between these two, because they are both important, but at the better if they're working together. And the diet, we're talking about the caloric deficit, because you need to cut off your calorie to lose some weight or some fat, but also the quality of your diet. When you look at what are you eating every day, when you are looking at fibers, for example, is important also for your glucose regulation. And when we talk about diet, the Mediterranean diet is also coming on the top of what is working best and what's more healthy for your patient. So the combination needs to work together. So we need a holistic approach for the patient, and to find the way for each individuals to find his way for getting a healthy lifestyle. So it's feasible. Long answer, but it's feasible. Only you have to know what you're doing. Yeah.
So we had the conversation with Professor Dr. Manuel Romero Gomez, and he stressed especially this. So there are several things in this chain of terminology, healthy lifestyle, and they should be addressed all together. And just to remind our audience, we have also a special session with a medical doctor from Amsterdam, Stan Driesen, who spoke more about the nutrition. So I'm just inviting all of you to also check that episode. And we are moving forward with physical activity. So let's maybe firstly define what physical activity is. At what point can someone be considered active enough? What is the measure? How someone know to check that box? Okay, I'm physically active enough.
Yeah, you have to check two parameters here. It says how much time you need to have on being some physical activity. So here we're talking about 150 to 300 minutes a week doing some physical activity, and also the intensity. And when we're talking about 150 to 300 minutes a week, it's for moderate intensity. But what is moderate intensity? It's when you can still be able to talk, for example, and you are working, you are cycling, you are doing your stuff, dancing, doing some nice activities. You don't have to think about doing some sports, some workout. If you take your bike to go to your work, this is physical activity also. So you have to count it also in the whole amount of time you are doing it. And if you say I'm going to the gym, for example, or with a group, or with another sport like football, soccer, you want to do, then you can reduce the time because you're more active. And then there are activities when you're experiencing more shorter breathness, and then it's more important, and then it's like the health of what you're producing. So 75 to 150 minutes a week. This is for adults, because for children it's a little bit more. It's an hour a day, but at the end of the week you have to take everything, and it's easy to say that you have to walk 30 minutes a day, and then you're doing it great.
So what are some of your practical suggestions to patients how they should be more physically active? You just mentioned that it doesn't have to be really like specific 60 minutes per day, but how to incorporate?
I think you have first to focus on your daily life, because that's the most important time of your day, when you're not completely conscious of what you're doing. And there are small tips, and it's easy tips. But for example, if you take the stair instead of the lift, if you have to take your car, for example, to go to your work, can you take your bike? In the Netherlands, it's really common to take your bike, so that's always an example.
You're already there.
Yeah, so that's really normal.
Have to wait a little bit.
Yeah. But if you have to take your car because you have to work like an hour driving, you can take your car, but you don't need to park your car in front of the door. You can also park your car at the end of the parking lot, and then just have a walk, and then just take every moment, every minute are counting. And I remember it was a study showing that if you take just 22 minutes time of walking every day, then you can lose more than 5% of body weight at the end of the journey. So it's very important to feel good in what you're doing, and you don't have to think directly on workout or sport.
Let's maybe touch on the effort of physical activity. So I know that we have the vigorous activity and we have moderate activity.
Yeah.
Is that correct?
Yeah.
Can you touch on difference on that just for the audience to understand what is the main difference?
The main difference is when you're talking about physiology, you can measure the amount of energy you're spending for doing some effort. And when we're talking about moderate activity, we look at the metabolic equivalent of task is like a kilogram on your scale, for example. It's a way to measure it. And then when looking at it, it's like for let's say format is like 30 minutes, 5 kilometers an hour maximum, and then you're doing formats. When you're talking about vigorous activity, then it's more an activity you breathe much faster, harder to talk. You have to focus on what you're doing, because otherwise you're not able to pursue your efforts.
What actually happens in the liver while we move?
A lot of things. No, that's really an interesting organ.
I mean, why is it so important, for us to be physically active if we are...
Yeah, because that's the question. With MASLD and physical activity, why do I have to do for my liver? Because people think it's good for my heart, for my lungs and my muscle, and the liver, so be it. But you have a lot of mechanism working in the liver when you're making some physical activity. So first you have to use more energy. So you're boosting your fat metabolism and you're burning more fat as fuel. Then what I told you at the beginning, you're controlling and improving your blood sugar, because you need sugar to produce energy also. And then when you're doing some activity, you're challenging your body to use sugar properly to produce the right amount of energy. And when you're training, that's the only thing what you're doing is learning your body to work more efficiently. So everybody work on the same way, only the one is working better than the other. Then you have this kind of detoxification, because the blood flow in your liver is improving, because you have to pump more blood in your body when you're moving, and your liver is a big center for detoxification. So you're also improving it. And then when you have less toxin, less garbage in your blood, then the inflammation, the reaction of your body is going down, because you're getting healthier, and then you promote then a healthy metabolism, just challenging your body to improve every metabolic steps. So for the liver, it's really quite an important part of getting healthier.
I think you were very convincing.
Oh.
It's a very clear explanation. Maybe let's touch on the importance of physical activity when it comes to regeneration of liver.
Yeah, so that's what I explained. You improve your blood flow, and then you reduce the fat accumulation, and your liver cells are getting healthier, and they're producing also growth factor to promote the growth and regeneration. And what you have when you're doing physical activity, you creating a kind of mild stress for your body, and your body is looking at what is going well and what is not going well. And when you have some cells from the liver or other part of your body not working really good, it's not helpful to produce the energy you have to. So it's cleaning it up. We call that autophagy. And
fancy term,
yeah.
Another medical fancy.
It's you have to, in a simple way, to cell breakdown and remove damage or the dysfunctional components. So the bad cell are just clean up, and the cell we're still working, we try to make it better. In your cell you get the mitochondria. It's a kind of powerhouse of the cell, and then it's making the energy, and then you also cleaning the bad one and creating a better one. So you enhancing the liver function actually. So at long term it's on the cell level, but you're making your liver just better to do its function. Yeah.
Can you back these things with some kind of research or clinical research studies? Can you share that with us?
Of course, there are a lot of research. Now we have what we call systematic review. So for people who do not know what it is a scientific article, but all different articles in one to have an idea about the topic. And we have different systematic review that's showing that physical activity, and we were talking about the 150 minutes a week, is really good for your liver, because you have the reduction of the liver fat, and you have also an improvement of liver function. So they did the same experience on animal, like mice. So they put it on a diet and put it on the treadmill. So you put the mice on a treadmill to have healthy mice, and you also see that they're getting better with the liver function. And we see the same, of course, in a real life example with lifestyle changes and on intervention where you improve liver function and overall health. And here it's important to know. Maybe we'll talk about it later. But the HIIT training, so it's a short term for high intensity interval training, it's also producing more effect of individual or the mice about liver fat and liver function. So it's also a way to think about physical activity, how to manage it and how to incorporate it for a better liver health and overall health.
Let's touch a little bit on the scientific guidelines that we have now. So what does scientific guidelines recommend?
Now, scientific guidelines, when we're talking about physical activity but also weight loss, you have to aim for 5 to 10% of weight reduction, and that's the goal you have to set for yourself to have benefit of what you're doing.
And how should patients start this approach? When you speak to patients, how they should start, how they should maybe, if they already started, they are somewhere in the middle, they are maybe experiencing a little bit of setbacks, how you keep them motivated?
Yeah, I think it's important for the patient to have the big picture, because when I'm a healthcare professional, so I see people from the beginning till the end. So I got a better idea about how the patient journey is looking. But when you're busy with yourself, sometimes you're losing kind of overview where you're going and what you have to do. But I always say to the patient, you have to start first. Starting is the best
and
that you can do.
That's already a huge step,
It's already a huge step, yeah. Then, according to your health, maybe it would be good to have first a kind of medical clearance. For example, if you have obesity or if you have diabetes, talk to your GP or your internist, for example, to talk, do I have to do something, for example, for my medication, or do I have to think about something different? But first talk to your medical contact to do it. Then you have to start slow, because you have to focus on the consistency and not on the intensity. Because if you say, I want to run a marathon, you're not starting this weekend with 30 kilometers. You're starting this weekend with maybe 4 or 5 kilometers to check how you're doing. And maybe you have to stop in between because you have to need some rest. So start slow. And then you have to split your training in a kind of everything is good, aerobic training, so cardio training, but also resistance training. Mm-hmm. Some people think I have to do this, I have to do that. You have to do both, because you need some basic condition, basic fitness, but you also need strong muscles to produce the perfect effort, and you have to mix both. So focus on both is really good. And then when you
can I jump in with a question? So what actually is a resistance training, strength training, to bring it closer to the audience?
The difference between aerobic training and resistance training including weightlifting, bodyweight exercise, for example, squats, push-ups, the classical exercise you can have, and
so
you can
focus on the muscle mass.
On the muscle mass, and you don't need to be too complicated. You can do it at home, sitting on a chair, and then just and stand up. It's already a kind of resistance training. If you can also have some elastic bands, for resistance bands, you can buy it for almost nothing now, and that's added to your resistance training to make it more difficult. But the point of resistance training, people are always they always stick to a kind of program. What I heard, more often you have to do 3 sets of 10 or 15 repetitions. That's what people say. But if you can do 20, why don't you do 20? If it's 15, it's too much. Why do you have to push yourself to 15 and have some pain? So you have to listen to your body. That's the next step maybe for this podcast. So the tips you can have for the resistance training. But you have to do what you can do, and you have to stop when it's too much. And that's also here from the training, you're learning your body. Where is your limit? And getting fitter is not doing better. It's also knowing better how you're working, what your body is possible to do.
Are there any exercise that liver patients should avoid or to be cautious of?
I wouldn't say you can't do it, but you have to be cautious with. So we're talking about the HIIT training, so the high intensity interval training. You should first build a good base for level of fitness to start it. Then the liver, it's in your belly, so you have to be careful with some exercise with abdominal strains, because you can increase the intra-abdominal pressure, and for some people in the advanced stage, it could be painful, so you have to, if it's painful, you have to stop it. You have to.
It's a clear signal,
yes,
right? And
you have to make the
and uncomfortable feeling. It's a signal that from your body.
Yeah,
and you should be a little bit.
And there's a slight limit in the kind of way that you have to make the difference between the discomfort, like going out of your comfort zone, and having some pain and some troubles, and then it's personal. So I can tell you have to do this, but you're the one here who can say it's too much for me or not. So you have to be out of your comfort zone, but you don't have to experience pain or problem. And
but
then
you're actually saying that any type of like a mild, not pain, we call it soreness, right?
Yeah.
After the session.
To feel your body, it's okay. Feeling your
is,
body is normal.
Yeah,
it's normal.
this is still okay.
This is normal. But if you're lying in bed for a week, it's not good. So that's the two things. And then when you have some problem with overweight or obesity, be also aware that you have some impact on your joints. So you are talking about walking a mile. Yesterday we were at the European Parliament and we see this personal experience of someone who have to walk a mile to take the bus, and then she was completely broken at the end. That's not the point of getting some physical activity. So if you have to choose something you can manage the impact. Dus I say my patient again in the Netherlands, take your bike, for example, would be better for your knees if you have knee problems than getting a mile or running a mile. And then you can still make it as hard as you want, but you're still moving. But at the end, you maybe experience less pain on your knee, for example, in that kind of situation.
Would you say that patients usually overdo to, or how should I say it? Push themselves too much at the beginning before,
If you say it so, it's like people are not doing great, but that's maybe the problem here. People want to make it too good. Mm-hmm. And then I get some patient and they want to, they have a goal, whatever it can be. It's losing weight, running a marathon, and you can name everything. And then they want to go for it, and they want to make it so quick as possible. And then they're thinking, if I train 6 days a week, it will be easier to go further. But you don't have to forget you need also some rest to recover for your physical activity. And rest is also the moment when your body is building a better body for your goal. So sometimes less is more.
Is that also why sleep is important?
Yes, of course.
Because actually sleep is like a natural part of the day where our whole body is
sleep
regenerating.
is one of the main reason also for some metabolic problems. And an easy one is when you took two person, the same person, and they're doing exactly the same, but one is sleeping well and the other is not sleeping as good as the first one, then this one will have more gain weight, for example, in his life than the other one. So you can eat the same thing, but if you're not sleeping well, you're getting more weight if you're not sleeping well. And when you look at the extreme, for example, bodybuilders, they have an obligation to have a, what do you call that? I'm thinking about Manuel Romero about siesta, but you have to take a nap in the midday just to recover from your first training on the morning. So sleep is really important. People underestimate it, but you have to go at time in bed to have your 7 hours at least for a good sleep. And try to, there are a lot of, we can talk about sleep in another podcast.
That's another session.
The rules, a dark room and no noises, and then a cool environment is important to have a good sleep. Yeah.
So you're saying sleep is important when it comes to physical activity to reach the result, but also nutrition, the right nutrients, quality before the quantity, right?
Yes.
Okay, let's move forward. High intensity interval training. Let's maybe firstly define what this is. And
it's in the name.
It's in, oh, sorry. It's here. Yeah, sorry. So
the high intensity interval training. So there are short bursts of intense exercise with a period of rest of lower intensity. So to be practical, for example, you're working as hard as you can for 3 minutes, and it takes 1 minute rest. So that's one of the way of doing it. One of the first HIIT training was from Mr. Tanaka from Japan, and it was for the short track teams, and he did a 20-10. So 20 seconds of workout and 10 seconds of rest. I would say 20 seconds is nothing, but when you do it 8 times, so 4 minutes in total, trust me, you wish you die.
If you do it correctly. And you also mentioned that there is a limit that you cannot do HIIT training for like 1 hour, right?
Exactly, because when you're doing your HIIT training, you provoking an extremely high stress level for your body, because when you're doing your 20 seconds and 10 seconds of rest, you have to go as hard as you can. There are some protocols when you only you go on the bike for 30 seconds and then another time or 30 seconds, 4 minutes later. But you have to go as hard as you can. And when you're doing it, your body, in terms of physiology, maybe too complicated for now, you can't sustain it more than 15, 16 minutes. So if you say I'm doing 3 minutes of work and 1 minute of rest, then you can do it 4, maybe 5 times, and then you're done. So somehow it's also a good news, because you don't need so much time to produce an effort and to make a training. So if you say, I'm really busy, I don't have time to go to the gym and do my stuff, no problem. Give me 15 minutes and it's good enough, because you're doing it well.
That's why I'm asking, because we all are living in a crazy environment and life. Everything is super fast.
Yeah.
So that's why maybe this also for the audience, because you can read about HIIT training all over the place. Mm-hmm. So just wanted to touch on that. Maybe a question, is HIIT training also if somebody is walking super fast for 3 minutes and then walk a little bit slower?
Yeah.
Or should this 3 minutes or should this intensity be really like more like a complex movement? Given the fact that like walking is something that it's, let's say,
the point is to see where is your level of fitness. Because, for example, if you're someone who is going to run a marathon and you're running easily 15 kilometers at 13 kilometers an hour, walking really hard 5 kilometers per hour, it wouldn't be the good trigger to produce the HIIT effect. So you have to level to your own level of fitness. So one way, we'll talk about it later, about to track your heart rate, for example. You can also use it, but you need to go on the upper side of your condition. And when you're looking at the literature, HIIT training is more often defined as going like above 70 or 80% of your maximum of heart rate. So if for you're
really fast
to reach exactly.
That.
But some people are really have a lot of limitation. They have problem to walk, for example. Like walking 5 kilometers an hour, it's already top sport. So for some people it would be enough, and for others it would be too low. So you have to look at yourself, and if you say, no, I'm easy here and I can still keep going on, then you have to be happy with your rest. That's the aim point. When you're doing HIIT training, we're happy with the rest, and the rest is always too short.
Okay, really, let's jump to another question. What if someone isn't losing weight despite all the efforts, all the instructions and suggestions they are following, but the weight loss is not there yet? How can you help?
That's frustrating because more often people want to see the result on the scale, but sometimes you don't see it. But you have to keep in mind that you're also making some improvement on other levels. And we talked at the beginning, for example, when you're doing some physical activity, your liver is working proper, and you have an improvement of the liver function. Then you got also metabolic benefits. Your glucose control is also better. Your insulin resistance is dropping down, so it's getting better for your body to work. You have also a reduction of inflammation, so your stress level is getting down. You got psychological effect because your well-being, getting outside for a walk or just moving. We were talking about the sleep quality when you were in your training, and after that you go to bed, you sleep better. So that's also a win here. And at the end you have some enhanced quality of life because the total is also making you a happier and better person. So the weight can be a goal and a frustration for the patient, but that's not the target. And when we look at our patient in the hospital, if they're not losing weight, that's okay, that's a point, but we are also looking at the whole picture. And some people, the body composition also a good discussion here. And I've had once this patient, he was with a BMI of 27, and he came for control, and we see before he come his BMI was 30. So you think, oh, he's not doing well because 3 points is not good. It was a young guy, and he went for bodybuilding, and it was with just 12% of body fat, and really just a build up. So it was a good surprise. So your weight is a way to check things, but that's not the holy grail that you have to look at.
So as you always say, start slowly, continue every day is a new day, just focus on small steps.
Focus on the discipline, not on the numbers. Because after that, even if you're losing weight, still you say, I want to lose 5 kilograms, for example, and you're doing everything perfect, and you're losing 5 kilograms. After that, do you have to stop? You still have to do the work. You still have to stick to the routine. You still have to be aware of what you're doing, what you're eating, and then enjoying life. So if you stick on to the numbers, you're still not there.
Is there any evidence that shows exercise alone can reduce liver fat and inflammation?
Yeah, there are several studies have been produced the last year. They look at aerobic exercise. They're looking for the reducing liver fat. So that's one part, and we see that in 12 weeks you can do it easily, and so they are directly affect on your liver. They're also looking not only at the body fat, but also on your level of inflammation. You have some markers in blood who can show that people are getting better. So some markers of inflammation. They're looking also just at the HIIT training, what we just talked about. And we see that the liver fat is also dropping down, and then it's independent of the body weight changes. That's what we just say. If you're not losing weight, you're still doing better with metabolic health. And then what's important is the consistency of your activity. You have to keep it ongoing on a repetitive way. Then at the end, you have a real win.
Since you just gave us a lot of data and information, let's stick with that a little bit. So patients with MASLD often suffer from other conditions like diabetes or obesity, which require certain medications. So let's touch on medications, how they influence maybe the level of energy of patients, so that I guess they are affected by that to continue with their physical activity.
That's a complicated question because you have different type of medication. One is, for example, for diabetes. The other is for obesity. And all medication are not for diabetes or obesity, but they are also on. So I try to give a general advice, but you have to check it with your GP or your internist if you are under control. What you have to understand is some medication are there to regulate your blood sugar. And if you're going too low in your blood sugar and you do some physical activity, you may suffer from dizziness, from not well-being, from all the negative symptoms you can have. So your blood sugar is going down, so it can have an effect on your energy level. All medication has no impact on your system for physical activity. I'm thinking about metformin is one of the more common medication for diabetes patient, so you can use it. Then you have some medication is for diabetes, but also for obesity, the GLP-1 now on the market, and they're also regulating your blood sugar. You're more efficient with the blood sugar control. So there you can also have some weight loss with this medication, but also some gastrointestinal effects. So if you have to run, but you're not feeling well with your gut, then it could be a problem. And then the other part of the medication I told you that effect have on your body weight, for example, antipsychotica, for example. Then there are some antidepressants. They have the side effect that you're gaining weight. So it can also be frustrating if you based on healthy lifestyle, but you have to take this medication and you're gaining weight through this medication. So you have to make it open with your GP or your internist or your healthcare professional to talk about the medication. What is your goal? And if you can change, or if you have to change something, if there are the possibilities to adapt it.
But I believe this is a very important topic. If you really don't feel well or you're suffering from fatigue, it should be really like open conversation that it's normal, and then maybe you should just lower the intensity for that day. You amend your weekly training plan, and that it's just part of the journey,
exactly.
right?
And you don't have only good days, also you have to accept that you have some bad days, and making open with your healthcare professional, he or she will always be happy to talk with you about it. Good talk.
So, indeed, lifestyle intervention involves more than just exercise. You mentioned sleep, you mentioned diet, and the whole aspect of change of the behavior. So how do patients typically react when they are told that they need to adapt all of these things? It's not just one thing, but it's like a complex basket of
there's a big
things.
change, exactly, you said properly, and then you have several responses from people. The first one would be a kind of initial resistance of denial, like, why do I have to change it? I don't understand. I'm doing it well. The problem is not from me, it's from another sickness, and then you have to, as doctor, you have to help me. So they are kind of denial. The other is opposite. It's like, oh, okay, I had the power to change it, and I have the power to control it. So I want to be involved in this change, and I want to do everything it's possible for me to be healthier. Then, if you want to change it, some people are a bit confused or overwhelmed because there's a lot of aspects you need to know. There are a lot of things you need to change. And then, where do I start? What do I do? Am I doing great or not? And who is going to control it? So it's going to also be a lot of information at once for the patient, and where he doesn't know where he has to start. Then you have those who say, okay, I have to change, but it's completely different than what I'm doing now. So it's quite a challenge, because I want to change, but that's completely different. So I have to eat differently, I have to move differently, I have to change everything. And it's some from people it's a problem. So you need to create a kind of gradual acceptance to encourage your patient to do it, and to cheer it to when he's doing well, and try to involve also his social network, his family, friends, at work to make it better. And that will be easier to achieve the goal to be healthy.
Do you have any tips and tricks for patients to do that?
Make it what we said at the beginning. Start low, start slow, and focus on what you're doing and not what you're achieving. Because what I told you, even if your goal is achieved, you still have to do the work. So you have to have a long-term commitment, and you have to make a habit, and it has to be in your life, and not as something, a part of your life you're taking for a while. So that's the best tip I can say to the patient, and to make it also open with his family and network, because when you know that I'm busy with something, you can understand me and you can help me to achieve my goal. But if I'm doing it on my side and you don't know why you're not doing it with me, then it can create some conflict between persons.
And what do you see for patients to be like the biggest motivation? Is it something personal? Is it something just, okay, I will improve my condition to be there for others?
There are two kinds of motivation. There are the internal motivation for yourself. You want to be better for yourself, and you want to be healthy, and not to have the loss of for if you have diabetes, you have to take medication. I don't want to take medications, I do it for myself. And then you have the other part, patients who are doing it for another. Orphan children are a good motivator because they want to do something with the family, they want to be healthy for the other, to be there for the other. And then it's always also a good goal to try to do it, yeah.
My next question really is about the wearables and tracking progress. So because we are living in this digital era, even if you want, it's very challenging.
You can't skip it, yeah.
So where do you see the role of these wearables? Are they beneficial? Are they super important? Are they simply good to be there and use the data that they are giving us?
First, you have to know what you can expect from these wearables. I think the first reason that people buy it is first to track their physical activity. When you go for a run, or if you go for a swim or a cycling moment, you want to see how long was it, and what was my heart rate, and how many kilometers, and what was my speed, and to track everything. So that's the first point. But then you can use it also to encourage exercise, because you can some notification. For example, I got a smartwatch, and when I'm sitting behind my computer, say it's now an hour you're sitting behind your computer, you have to go for a walk or some stretch exercises, so you can encourage yourself to have the habit of being active at some point of time. Then you can also use it to track your nutrition. You have now all the application on your smartphone to scan your plate and to see what you're eating and how many calories and proteins and carbs and the other things you have. So you can
can also be overwhelming, right?
And that's the problem. That's the problem. It's like checking your weight on the scale. It's not everything, and you have to learn to live without it. So you have to use it as like help, but you also need to focus that life is not on your smartwatch or your mobile phone. So
but are you still recommending to your patients that they use the wearables?
Yeah.
Because I guess it gives them some kind of a feedback.
It's good for them, it's good for me, because when I'm talking to someone, he's saying, I'm doing my best and I'm not losing weight. And if I ask the question, why are you doing the physical activity? And they just say, I'm working a lot. What is a lot? For some people, it's 2,000 steps, the other is 20,000 steps a day. So you can make some points more objective to discuss about it. And if you're just working 2,000 a day, you can be frustrated that you're not losing weight, but somehow you have an explanation because you're too low in your physical activity level. And then if it's possible or not, it's another question, but you can make it objective to discuss and to have a point to start somewhere.
You mentioned earlier the level of intensity, measuring with the formula, with the heart rate.
Oh, with the heart
right?
rate, yes.
I can't remember if we touched on that or no, but I think it's very important because it's a very easy formula and it can give you...
The easiest, there are a lot of ways to measure it, or to make a projection of it. The easiest way is to use the following one. So take a pen and just write it. It's 220 minus your age, and that is technically or theoretically the maximum heart rate you can have. So if you're 50 years old, 220 min 50 is 170, and based on this, you know that 170 will be the max you can reach with your heart rate. Some people will be more and others will be less, but it's a kind of indication. And then based on that, say, okay, 170 is my max. So if I want to train at 50%, for example, then you have at 85 heart rate per minute. And if you want to go higher in HIIT, HIIT training, so that's like 80% of this. So I have to think it's 146, if I'm doing right. You have to reach 146. And if you're not to 146, then you're not really in a HIIT training zone.
Thank you really for that. I think this is very easy to use formula. It's really something practical that any one of us or patient community can use. We are jumping forward to a big topic, bariatric surgery.
Big one.
The big one. So I guess the very general question is, should patients move
Yes.
before,
Yes.
after? Yes, the answer is yes.
They always have to move.
But let's go deeper. Before surgery, post surgery, how are there maybe certain moves that they should be avoiding?
Now, when talking about physical activity and bariatric surgery, I'm thinking about two things. The first is when you're getting a bariatric surgery because you are suffering from obesity, then you're losing weight after that. That's the point of the surgery. But you're losing fat mass, but also a lot of muscle mass. And some studies, it was one of my colleagues in the Netherlands, they show that the patient is losing 8 to 9 kilogram of muscle mass after bariatric surgery. So that's quite a lot. And you want to prevent it, because when you have more muscle mass after such a surgery, then you will also have a greater result in terms of weight loss, but also metabolic health. So that's important here. Then when you're preparing your surgery, you also have a better recovery when you're more, your level of fitness is higher. So you don't have to wait until the surgery or after the surgery to start doing something. Doing at the beginning would be easier, also to maintain it after the surgery, because it would become a habit. So you have to prepare before. And all the studies shows that the prehabilitation, what we call prehabilitation, is a rehabilitation but before the surgery, helps in different ways for the recovery. After the surgery, the problem is that you have quite a big surgery. You still have stitches. You have at least 5 wounds in your belly. So then you have to be aware that your abdominal muscle could be sore or could be painful. In the theory, you need 6 weeks to recover from a muscle, what do you call it, torn muscle. So you have to be careful. So it means you don't have to stay 6 weeks in bed. You have to move. And what we say, you start with walking. If you start walking every day, it's already good. And then the second rule I gave to my patient is, if it's not giving you pain, if you not experience pain, it's good. If it's out, it's not good. So just do everything you want to do. If you want to go to the gym, if you want to go swimming, cycling, walking, running, everything. If you're feeling great, just keep doing it. But if you feel discomfort, if you feel pain in your belly, then you have to stop it. And if you want to go if you say I want to go swimming, you always have to wait until the stitches are gone or the wound is closed, because you can have an infection or you can contaminate water. So you have to wait 2 to 3 weeks to go for a swim. But yes, physical activity after surgery is also important for the result and for your health to maintain muscle mass. Yeah.
But you said the results of the surgery can be greatly affected by the preparation, right?
Exactly. And the first year after the surgery, is the moment when you're losing the most weight. Some people go to 1 year and a half in the losing weight phase, but the first year is the most important. And the first year, the more weight you lose, the better is for the future. Because everybody lose weight the first year and then stabilize, and then after a year and a half, sometimes 2 years, they're gaining weight. Was normal. That's a normal process. But if in the first year you're losing weight and you keep your muscle mass, the weight gain will not be so important, and then you have a better result on the long term.
How long ahead of the surgery you should start preparing for the surgery?
I would say at least 6 weeks before the surgery to have significant results. But everything is good. I mean, if you start working before surgery, just 2 weeks before the surgery, is better than not doing it.
Yes, as you said at the beginning, focus on a daily improvement.
Exactly. You have to make a habit. Active. So 6 weeks before the surgery, it would be perfect, and mix a aerobic training and a resistance training for the muscle mass and your level of fitness, cardio training. Yeah.
Moving forward to liver cancer and physical activity. Where are we standing with that?
That kind
for liver cancer patients.
Yeah, that kind of stadium of liver disease is it's more complicated because there's not a diagnosis. But physical activity is also good there because you can have a lot of beneficial effects of physical activity. The first one, you improve your physical functioning. when you keep moving, you can maintain a kind of level of fitness to be able to participate on your daily life. And then somehow you're helping people in the quality of life, because when you're going through treatment of liver cancer, you're also dependent from others, and you're also affected by your treatments. So you need a lot of help. But if you can keep doing it yourself, it's also good for your quality of life to be able to be to keep going doing your stuff. Then you had a better prognosis, potential better prognosis. So people going for chemotherapy, for example, when they are more active, they are better than people who are not. It's not true for everyone, but in general, we can say that being active helps the treatment to be more effective. And then you can manage the symptoms and enhance the response to treatment. So more often when you are the treatment for cancer, then you may have experienced some symptoms, and then in some situation you can have what do you call that? Seems like a lower experience less symptom than normally. So physical activity that kind of way really good, but still here you have to tailor your physical activity for patient to see for each patient what he can do, when he can do it, and to be an individual program for them. There are a lot of programs now for people with not only for liver cancer but for other cancer to try to keep this level of fitness, because it's also proven in literature that we have a good response on the treatment with physical activity.
Are there any specific types of physical activity that can be safely incorporated into the treatment plan for liver cancer patients?
Now, I would say we stick to the same pattern, like aerobic training and resistance training. There you can add also for the people, but in this patient population especially, you can ask some flexibility and stretch exercise to keep your body flexible. And then when you have some radiotherapy, for example, then you can have some scars which limits your range of motion. So try to keep it at the balance exercise is also good. Functional training, and then the part of mindfulness training is also important, because it's a kind of sport. Busy we had, but to feel better with what you're doing, and achieve a well-being state for yourself in this period.
So what you just said is basically you stated that we just stayed on the surface with this episode, because it can go much deeper.
There are a lot of
when
say
you
again.
say physical activity, so we have material for more. But unfortunately, we are at the end slowly of our session, so maybe I will give you the floor for any statements or messages to our audience.
Yeah, what I told in this podcast, physical activity is an important part of a healthy lifestyle. You don't have to see it as something painful or complicated. Just start somewhere, ask for help, do it together with your family, friends, social networks, what you have. Use the good tools to help you to achieve your goal, and not focus on your weight, because the weight is something, but at the end you still have to do the job, and then enjoy it. That's a more important message here. You have to enjoy what you're doing, because at some point, if you're not having some pleasure in what you're doing, you will stop. Is it tomorrow or for a week, but you will stop. So doing something which is for your life and where you have some pleasure in it. Yeah.
And as you said, incorporate SMART goals.
SMART goals. We didn't talk about the SMART goals.
Yes,
That's true.
yes.
Yeah. So really quick, the SMART goals. That's a way to make a goal. The SMART goal is specific, measurable, achievable, reproducible, and time related. So you have to be specific, kind of over 10 weeks I'm able to do this, for example, to walk 5 kilometers, for example. And then you have a concrete goal that you can measure, you can reproduce it, and it's realistic. So start with a goal and start somewhere.
Very good. So let's close this session with the SMART goals. So thank you very much, Willy, for being with us. Very valuable information.
Thank you.
I believe that our audience will use it.
I hope so.
And so thank you very much for being with us. And See you soon. Bye.